interest kind of morphed a little bit because I got involved with working with some of the violence work group plans at the hospital and working with the nurses who also respond to emergent calls when there's been a violent patient. And there's a lot of work that needs to be done around that too. As most people know, healthcare workers have a high incidence of being recipients of violence, particularly from patients, and nurses tend to take it, and we don't want them to feel that way anymore. So we started doing some data gathering on these particular episodes to help us understand what kind of patient gets aggressive and violent. So my most recent research study has been looking at our population and determining if we can contribute to the science in regard to what kind of patient comes into the hospital seeking medical care but yet also becomes aggressive and ends up requiring more resources than a patient who isn't violent would. And then what my next step is, hopefully, what can we do to provide interventions in order to prevent the violence from occurring in the first place. As far as my research impacting clinical practice, we recently obtained our initial results for looking at what kinds of characteristics surround the circumstances of patients. The preliminary results look like they're going to help inform us in developing some kind of a screening tool that we can use for patients when they're admitted to the medical setting who may potentially become violent. There's a lot of screening tools and assessment tools for the psychiatric population. And some of those tools are being superimposed on the medical population, so it's not an exact fit. There's a lack of understanding what all contributes to a patient becoming violent in the medical setting. And so hopefully that will be the largest to date contribution that I'll have for my research. You know, when you get that data back, you realize that all the lit review that you did and all of the statistical analysis, when you get that back and you realize it actually might make a difference in helping somebody, that's the motivating part. It's interesting to pull all the information together, but it's even better when you can say, I moved it forward a step.